Hello, everybody. I'm here with my good friend, Deborah Duncan.
Oh, no, she's my better friend, okay? Yeah. Dr. Shel, Wellness and Aesthetics Center. Okay, I'm going to tell you, 2 years ago I came in here. I was feeling bad. I was a little plump. I was 174 pounds, and we were just noting that, going through my chart, because you guys can check up on things.
Of course, absolutely.
That I feel 1,000 times better. And are you ready for this, people? I don't know if they're ready for this. Okay, well,
tell them. Oh, there you go.
Yes.
Yes.
Mama got a groove back.
There you go. So 20 pounds lighter now.
Yeah. But what I love about this here is you've always preached, it's feel good on the inside, look good on the outside.
Absolutely.
And I'm just going to go back to my journey where I didn't know what was wrong with me for the longest.
And most women don't.
Yeah.
They feel like, they just need some medications to make it all together, but
that was the problem. I had doctors who were trying to medicate my symptoms, and that's not getting to the root of the problem.
Absolutely.
And I came in here, you asked me the right questions, you did the right testing, and you're going, okay, it's this and this, which a lot of women at my age, right? Progesterone, so hormone issues, testosterone issues, and then thyroid, that's right.
Big time. Thyroid's a big issue. You
look
awesome,
and
you feel great.
I feel
think
great.
That's the bigger win. It's how you feel. Are you sleeping well?
Right, I'm sleeping well, and then you look at the time of day right now. There are, a few years ago, I was like falling asleep at stoplights.
Absolutely.
Right, and now I'm ready to hit the club a little bit later. But what I love about here, though, Dr. Shel, you thought this out very well because you went through this yourself.
Absolutely, I did. When I was in my late 30s, I went through it right after Zeke was born. And I went through issues with fatigue and insomnia and weight gain and hair loss, lots of hair loss. And again, I went through the same journey.
And you're a doctor.
As millions of women do, right?
Yeah.
I went to my OB-GYN and I was told you need an antidepressant and a sleeping pill.
I was told you're old and had a baby, that's just what happens.
Yeah.
Okay,
yeah.
It's not that, right?
Yeah, no, it's
but
not that.
What I love about what you did is you put everything under one roof, because otherwise we're going to this doctor for that, this doctor for that, the whole bit. Let's start with just basically what's happening on the inside. Yes. Vitamins are so confusing to me.
Very confusing, but very important. So what have you learned? So what I always like to tell patients is that every vitamin is different. Number one, when you get things off the shelf and you get over-the-counter vitamins, they're not regulated. You don't know what they have in there. You don't know if they have fillers. You don't know if they're going to absorb. You don't know what's going on. So 50% of the time, and we've done studies have been done where 50% of the time it doesn't have what it says it has, or the dosing, and it cannot be
Or it doesn't have anything.
Right? It's placebo, and you're spending all this money on placebo.
Yeah.
So
this is pharmaceutical grade, meaning that it is what it says it is.
It has to be, because it's regulated. And so that's all I'll put on my shelf, and that's all I'll give to my patients. And a lot of these have been formulations that I've created over time based on the symptoms. Like our hair loss formula is something that most of our patients are on who are dealing with hair loss. Why did that come about? Because I lost hair. And it's very important because we women need that to feel good.
Our crown and glory.
That's right. That's right. So, whether it's libido formula, protein powder, digestive wellness, gut wellness.
Vitamin D, which a lot of us are deficient in, right?
Absolutely. We have to be on vitamin D. We have to be on binders to bind out the toxins that we're all exposed to, and detoxification. I would say do a detoxification at least a couple of times a year to get rid of all the toxins.
Besides wellness, you're also an OB-GYN. Yes. So you're used to talking about those things that most women don't want to talk about. And sexual health, up until recently, we just wouldn't admit things like dryness and
it's
incontinence.
Yeah, a lot of people. Yeah. Speaking of incontinence, let's go this way. This is the most awesome device that has been invented, in my opinion.
Oh wow! I don't know about this. What
yes,
is this?
So you will. So this is an electromagnetic stimulation device, which you literally clothes on, sit down, and you get your, machine turned on, tuned up, and in 28 minutes you feel like you've done 11,200 Kegel exercises.
Oh,
literally.
Wow. Okay.
11,200. So if you have incontinence, Deborah's like, let me on it. So all you do is you really you're just going up and you're waiting because it's, warming up and whatnot, but you'll feel it in a second, because what we're going to do is we're going to tune it to where you need it. Okay. And when you tune it where you need it, you're essentially turning it up. Okay. And here we go, starting right up. And
so exercises that muscle.
Exercises
because again,
that
as we get
muscle.
older, it gets lax,
so
right?
Tell me when you feel it, because we're only at 20%.
Oh.
How do you feel?
Oh, yeah. Oh, so things Something's happening here.
Something's happening. And so from a scientific perspective, all of our pelvic floor muscles get relaxed.
Right.
And they get loose, and you're gonna really start feeling it now.
Yeah.
And it's good. It's like doing Kegel exercises without doing Kegel exercises.
Huh.
And we can go all the way up, and at 28 minutes, you've done 11,200.
Wow.
So whether you have stress incontinence, urge incontinence, mixed incontinence, or even for men, it just got FDA approved for men with incontinence. And then as a side note, it helps with ED,
Oh,
erectile dysfunction and sexual dysfunction in women.
Okay.
And it's pretty fantastic. Our chair is usually busy all day long. People just come and say, "Can I just sit on it just for the joy of it?"
But yeah, let's replace the easy chair, the
Yes.
recliner, with one of those
There
right
you
there.
go.
Okay.
There you go.
Other services?
So we're going to go this way, and we've got the entire aesthetic wing over here because, of course, and we'll go back to how to feel good. But here we have the one of the aesthetic rooms, and when you go in here, and again, Deborah, you've experienced some of this stuff yourself, and you know, my big goal is you want to be able to treat skin, different skin types. I have a skin type 4, Deborah's skin type 5.
Yeah, well, that's the thing about you is that you do
Yes.
have an olive type skin, right? So you get the
Exactly.
fact that,
Yes.
that not all skin is the same color,
the
and not
same.
all lasers react to skin the same way,
Right,
right?
and you want to be safe, right? Safety and efficacious. So this is our injectable room with Botox fillers, Voluma, things like that. And then that's an amazing device. It's called L-Therapy. L-Therapy is for skin tightening. So you know, we all look in the mirror, we just want to pull things up. So that's what that does.
Yeah.
And then for acne, there's a blue light over there.
Because sometimes, especially if you have hormonal imbalances, all of a sudden what you had as a teenager comes back in
Comes
your...
back in
yeah,
menopause. I mean, menopausal acne,
Yeah.
right? We just have that all the time. And then over here, we've got this wonderful hydrofacial unit, which essentially will clean out your pores, will essentially give you that lymphatic massage. Not only that, will infuse you with hyaluronic acid and other such things that go into the skin. So with a regular facial, you're just cleansing.
Yeah,
But this
the outer layers,
infusing.
yeah,
Yes.
with the regular facial.
The other thing that we do here that's amazing, we just did it the other day, is a stem cell facial. So now we're
Ooh.
actually doing facials, PRP with microneedling and putting stem cells into
And
the
stem
face.
cells, so it's autologous, right? I mean, it's your own?
You can
or
use
no?
autologous or you can
Yeah.
use umbilical cord
Okay,
stem cells.
yeah,
They're
yeah, but
both
you-
fantastic.
To kind of tell it what to do,
Yes,
right?
you can tell it exactly what to do. And then tomorrow, as you know, we're having the body sculpting event. So we're going to be doing a lot of Coolsculpting. In fact, we're giving away Coolsculpting tomorrow, which is great. And Vanquish. Now, Deborah loves that.
Yeah.
Right?
Well, because a lot of us,
Yeah.
you know, the thing is that you can do all the exercises in the world,
Yes.
and our body, you can't really exercise to spot reduce.
Yes.
With this, you can spot
You
reduce.
can spot
Yeah.
reduce.
So
So
for
these-
issues right here,
Yes,
a lot of
you
women.
can have bulges here, you can have your, you know, waistband, you can have your love handles, even the chin. You can get rid of the chin fat with Cool Mini, and then the arms, the thighs, really anywhere, bra folds.
Yeah.
These are some of the devices. So that one is all about, you know, laser resurfacing, hair removal, vein removal. You can do tattoo removal. All of that can be done in this room very
Yeah.
safely. So you can do. There really aren't that many lasers that can do
Yeah.
that.
And you mentioned Coolsculpting. The great thing about it is it actually kills the actual fat cell, right?
Yes,
So it's
instead of just reducing it in size, it kills Coolsculpting here, which we've got all the new hand pieces, and then we've got the Vanquish, if you remember. That's the Vanquish hand, you know. So if you look at this area, this will cover everything from your lower abdomen, your arms, both sides. You can do any of those smaller areas.
Yeah.
So it's
So you go and you, which one do I get? What do I do? You have your experts here. Skin, I would do, or for this problem,
Absolutely.
I would do,
yeah.
right?
And the thing is, I mean, I really believe that I have to have all the latest technology. Because really, if you go to a center where they have just one unit, they're just going to try to push that unit.
Right.
But I like to combine combination and custom. It really works. I mean, the Kegel, how many of us can do 11,200 Kegels?
No.
Right? No. But you need to. You do it with fully clothed, come in, do the Kegels, do the device, and then you're gone.
Get a good magazine.
Yeah, there you go. So over here we have our wellness room where we do our testosterone pellet treatments. So you know about those.
Yeah. So
Right.
the deal with the pellets is that it gets like put in. It's like the size of like what, a grain of rice
Grain
almost.
of rice, yeah.
Right?
Yeah.
And the body calls on it when it needs it.
That's right. So, you know, a testosterone pellet will last for about 3 to 4 months in women and 4 to 6 months in men. And so your testosterone level is going to be more steady instead of, up and down or just all the way down. For menopausal women, we also give them an estradiol pellet, which can last up to 6 months.
Wow, okay, so a lot of women will say, testosterone, that's for men, right? Women do have testosterone, not at the same level that men do.
And they need it.
Yeah, but also, we also think of it as something that's just sexual, the sex drive.
Yes.
But it also has other benefits in the body.
Absolutely. Muscle mass, attention, there you go. Muscle mass, attentiveness, the drive, the motivation, the energy, as well as it's been shown by studies with Harvard and Johns Hopkins that it reduces your cardiovascular risk. Which is amazing.
Okay. Yeah.
So those are really important.
The other thing I want to make a point of, because people stop me on this all the time to ask me about it, is we're talking about balancing hormones. We're not talking about jacking you up.
No,
we're talking about when things
not.
are balanced. When you were younger, things were well, of course, when you were a teenager, they were all out of whack, right? But then they got into balance, and that's when you feel your best, you look your best, your immune system is
That's right.
It's homeostasis.
Right.
I was helping my son with his homework,
important.
right?
Yeah, absolutely.
Which means the body is just everybody's working well together.
And the thing is, you've got to really focus on all the hormones that have to be working together. So when I talk about hormones, we're talking about not just estrogen, progesterone, testosterone, but also your cortisol, your stress hormone, very important, your thyroid, your melatonin, your sleep hormone.
Yeah.
All of those have to be balanced, and all of your neurotransmitters. So we've really been testing people's neurotransmitters a lot, because imagine how much depression and anxiety there is in this country.
And again, you can
Right?
medicate those symptoms,
Yes.
but it comes with a whole lot of other issues, right?
Absolutely.
We don't want to medicate the symptoms.
Yes.
Real medicine is actually getting to what's causing it.
That's right.
And oftentimes what's causing it is a natural solution, which
That's
is another
right.
thing that you're really big on, is
Huge.
how do we do the natural solution? And I want to make a point here, because I remember when I had gone to several other doctors, they were going to prescribe medication for everything that I had. They said, oh, you have an early morning job and you're tired, we're going to give you Adderall for that.
Oh my gosh.
Oh, you're depressed, we're going to give you, and I'm not a depressed person. I kept
No.
saying, why am I depressed?
No.
We're going to give you an antidepressant for that one. Oh, you are gaining weight, we're going to give you like something to recirculate your sugars.
Oh my
then that one.
gosh.
But the thing they also said to me was, we're going to have you come in once a month to test your liver, because all 5 of those medications we want to give you are pretty hard on your liver, right?
Wow.
And I said,
Wow.
well, do you have a new liver for you on
I know,
standby,
right?
right?
Yeah.
And then ended up coming to you, and you're like, no. Let's
None
get to
of those
what
are
the
necessary.
issue is.
Root cause.
Right?
Root cause, yes.
But the other one, it was be about $1,500 a month worth
Oh
of
my
medication,
gosh. Wow.
right? And now I pay like $40 for my thyroid, right?
Yes.
I pay like $40 for my thyroid, and I think $20 for my
Yes.
progesterone,
Yes.
and then all my stuff. But point is this: people will say, "Oh, does insurance cover what you
Yes.
do?"
Yes.
And no, it does not. But I would spend all this money on medication,
Yes, and
or
not
I
get
spend
better.
money on all these things like, oh, there's a weight loss program over here, or there's a this over here, or oh, there's
Yeah.
this over here. We spend money on all those other things
Yeah.
as opposed to what the core thing is, and it's your money up front. But then
Yes.
after that,
Yeah,
you're good.
cruising.
Yeah.
You're sailing. And you feel like you did when you were in your 30s.
Yeah.
If not earlier.
Yeah.
And, we want our bodies back in balance. We really do. We want our immune system working. We want our thyroid working.
Yeah.
We want our hormones working, our nutrients working.
Yeah.
And the body is fully capable of healing itself.
Yeah. And I'm
we
gonna
just
go-
need to give it the environment.
Right. And I'm gonna
Yeah.
go back to that thought I had, because I just, this is my soapbox here, because, and I get why people worry about money. We get that,
Of
right?
course, of course.
But the deal is that when I didn't feel good, I was not going to be functional. If I kept going the way I was going, I would not be able to show up for my job.
No, absolutely not.
So
Yeah.
I'm like,
So now you're still working.
yeah, I'm still
and
working.
you're still the
I feel better than
superstar.
ever, right?
Yes,
And the whole
yes.
bit.
And
So,
look amazing.
Yeah. So what is feeling good worth to you is
That's
is a
right.
big point I wanna
Absolutely.
make.
Which brings us to a machine that's right behind us,
Oh,
right
what is
here.
this?
So this is for sexual health.
Oh.
And I say that because I don't want to call it just libido. It is sexual well-being, sexual health. This is a very important part of all of our lives, right? But women especially will get to the point, and you and I have talked about this so many times, Deborah, where they're just embarrassed. They don't want to talk about, oh, I have vaginal dryness, or oh, I can't have an orgasm, or oh, it's just too loose, or it's
Yeah,
not tight enough,
yeah.
or I don't feel anything, or so on and so forth. Or
Instead of talking to their partner
Yes.
about it, what they do is they just shut.
They shut
You're wearing the
down.
sweatpants to bed, even
Yes.
though it's like it's the summertime. Get the
Right.
sweatsuit off, right?
Exactly.
Like, don't touch me.
Right, and they're just embarrassed, and it's
Yeah.
sad, right? And so I think what we do here is we open up the conversation, and we make sure we ask the right questions so that women know that whether it's laxity, whether they've had 5 babies and things just don't feel the same, and that's normal. Even after 1 baby, that can happen. Whether they just can't have the pleasure, whether they are so dry, it's so painful, especially after breast cancer treatment or any other kind of chemotherapy.
Well, because a lot of chemotherapy kind of wrecks the hormone system, right?
Yes, absolutely. So everything just doesn't work. So we have 3 different devices that actually can repair that and heal that area, so that internally everything's healed.
Without having to do hormone therapy.
No hormones, exactly. No hormone therapy, just with the exact same laser that will stimulate the mucosa.
How many times have women come in and then you finally got it out of them and they felt like they were the only ones?
Absolutely. And they just feel like, I couldn't talk about this with anybody, even with their closest friends. And that's what's really sad to me. So I always, whenever I'm on stage talking to doctors and training them, I always say, please ask the question.
Yeah.
Please ask the question.
Yeah. But, coming from the OBGYN world,
well, I'm comfortable
you've seen a lot
about
of things. That's right.
I'm comfortable. But, I think that women, like you and I know.
I'm not afraid of this thing anymore. Yeah. I'm good with that.
That's right.
But yeah,
it's very, very important. It's an important conversation to have that a lot of us just don't have. We're going to make a couple more stops, and I think we're in good shape.
And we don't mean the bathroom either. We're not stopping right here yet.
So we're going to come in here, and this is our IV therapy room.
This is something I had no idea about, and we talked about earlier how many times people think they're taking the right vitamins, or we think we're eating food that's nutrient dense, and it doesn't really have in it what it used to.
Yes, it doesn't, because the soil is not the same.
When you can do an IV, now it's not a guessing game, and your body doesn't have to try to absorb it. It's in.
It's in 100% absorption. Whether it's you can do a Myers Plus IV with high dose vitamin C, with B vitamins, magnesium. You can do minerals, glutathione, which is the most powerful antioxidant that we know of.
Yeah.
Even vitamin C high doses is used for cancer treatments.
We have a lot of people who are going through chemo. In fact, the last woman I met who was going through chemo, her son was bringing her in. He goes, "Oh my gosh, she's outrunning me." And normally that's not the case for a lot of patients with chemo. You got to go through it, but this helps. The other thing I love is that everyone around me at one point went down with the flu, and I was like, anyone to play with at all? Anyone?
No, everybody's down.
Because it also helps to boost that immune system.
So anytime I tell patients all the time, whether you have sinusitis, the flu, or any other kind of infections, whether it's viral or bacterial, you want your immune system working.
Yeah.
So high dose vitamin C or a Myers Plus boosts you up right away.
Because every day your body is fighting all kinds of things that are coming at it, and at some point it loses, right?
Absolutely.
And that's when it comes out in sickness and stuff like that.
Absolutely. And then we kind of customize things. So we have things for athletes, so it improves your athletic performance or libido performance, or you can do a hangover IV after a weekend of having a lot of fun.
Yeah, because you're feeling so good. Right?
Yeah. And then that one is really interesting because it's called the UV light treatment. We treat a lot of patients with Lyme disease. So yes, chronic fatigue, fibromyalgia, Lyme disease, because we want to kill those Lyme agents without all these antibiotics that's going to wreck their gut.
Yeah.
So it's doing wonders for Lyme patients because it really goes in, and with UV light, it destroys the pathogens.
All right.
Which is amazing.
You also have the vitamin B12 shots?
Yes. Oh my gosh, which you're about to get one.
I'm about to get one.
So it's really great.
Isn't it funny, if you needed a shot to save your life, like to protect you from Ebola, you're like, oh no, a shot. But if it's like got Botox in it, or if it has some B12 in it, we're like, load me up.
Load me up right now. And B12 is great. I mean, it's going to give you immediate energy as well as just boost that up because B12 is such an important vitamin in your body, right? So the one that we're going to get is Slim Shot Plus today, girl.
I'm going to have to go shopping again and get some smaller clothes. Look, that is a little.
She's doing good there.
We got a little
doing excellent. And then we're going to make our final stop here. So this is something awesome that we just brought in, Deborah, which is I'm so excited about. So this thing that looks like a R2-D2 from Star Wars, right? This is an apheresis machine. Now, what apheresis is sort of the latest and greatest. I think I'm probably one of 2 places in the entire city that has this. One is in the medical center. Okay. What it does is it actually removes LDL from your body. So people who have high LDL, it removes that LDL as well as other toxins from your body.
Well, that's cool because oftentimes medication doesn't quite do it right, and it just doesn't get it done. It might give you a little bit of edge, but sooner or later your body just kind of loses out on that.
Right.
So
this is a filtration. So essentially you have 2 ports, one going in, one removing it, filters everything, filters the blood, and puts it back in.
Wow, Okay, we say LDL. Explain to folks what that is. If they're
So,
not
low,
familiar.
the low density lipoprotein, which is part of the cholesterol. So people who have very high LDL or have high cardiovascular risk, as well as a lot of toxins in their body, as well as people who have chronic fatigue, people who have fibromyalgia, people who have other things where they just aren't able to get past a certain point because they're filled with toxins.
Yeah.
Think about filtrating your blood safely and effectively.
Wow, that's
what
pretty cool.
this does.
Yeah. I
It's
know you said this was the last
really
stop,
cool.
but I was going to say one thing that's really important with you as well and makes the difference is that you sit down and have a conversation with you. All right, you go through the stuff with us one by one. You ask us how we feel. You're looking at us. You're looking at the science, right? Because you have to. Sometimes people just look at the test and go, "Oh no, you're within the range."
Yeah.
Well, whose range is that?
That's right.
If I am within the range, but I told you I feel awful.
Yes.
You don't
need
need
to, we need to go deeper. We need to find out what is going on.
Yeah.
And that range is not what is right for you.
Yeah.
You need to be at a different point because that's where you were 20 years ago. And that's where your body wants to be.
So
you
don't
need
start
to
guessing what
customize.
doctors you need. Don't start playing the Shel game. Just go to Shel to begin with. Okay?
That's right. That's
but
right.
Yeah, but I
So-
sincerely mean it when I say thank you. Because
it's
it
my
makes such a
pleasure.
difference in women's lives who are otherwise told that they were cuckoo or just deal with it or will medicate your symptoms.
Yeah.
Instead, I push the reset button on the second half of my life.
Yes.
Yay!
Thanks for joining us today. Hope you guys learned a lot, and we will see you next time.
Did you want to see the muscle again? I'm sorry. Did you say that? Did you say that? I think you did. I think you did.